next one will be Dr. Gaurav. Is there? Yeah, he's going to present to us on the clinical study of visual prognosis of RVO in relation to posterior segment OCT.
Good morning, everyone. Today I'll be presenting on the topic of clinical study of visual prognosis of RVO in relation to posterior segment OCT parameters. To begin with, aim of my study was to study visual prognosis of RVO based on the optical coherence tomography parameters to evaluate SD-OCT features associated with the baseline vision and visual outcomes after 3 monthly ranibizumab doses in the prospective study conducted during December 20 to May 22. My inclusion criteria were all the diseases diagnosed with the RVO. Patient has to be conscious, cooperative, and well-oriented. The exclusion criteria was patients who have received previous intravitreal anti-VEGFs and other retinal pathologies, including diabetic retinopathy and rest of the pathologies. Also, hazy media and vitreous hemorrhage were excluded. These were the materials and methods used throughout the course of study. So the main biomarkers which we used were central subfield thickness, hyperreflective foci, drill, ISOH junction break, neurosensory detachment, and retinoschisis, and they were analyzed on univariate and multivariate regression analysis. So these are the few actual patients OCT scans which shows intraretinal size more than 15 microns, central retinal thickness more than 500 microns. Coming to the observation and result part, most common age group which was affected with the RVO was 56 to 65 years of age. Almost 38 patients were affected in this age. Male preponderance was noted. Then out of 100 patients, 53 patients were of BRVO. 54 patients were presented with the poorer visual acuity at the time of presentation. Of all patients, CRVO counts for 61% of the patients who had poorer visual acuity at the time of presentation. Drill as well as neurosensory detachment were the most common biomarkers noted. So association of the biomarkers with the visual acuity, size of cyst less than 15 micron accounted for the good visual acuity at the time of presentation, that is 76%, whereas retinoschisis and hyperreflective foci had poorer visual acuity at the time of presentation. Neurosensory detachment had shown most common association with the BRVO as well as CRVO. So effect of ranibizumab on these biomarkers, neurosensory detachment, ISOH junction break, drill, and logMAR vision less than 1 has shown statistically significant correlation with the ranibizumab. In this particular table, logMAR vision pre-injection as well as post-injection is noted. Pre-injection it was 1 and after injection it has improved to 0.4 which is statistically significant. Also central retinal thickness, which was pre-operatively 488 micron, has reduced to 278 microns. After multivariate regression analysis, we came down to younger patients, size of cyst and CRT are important for the visual prognosis. All this data has been correlated with the different studies, Haire, Fong et al., Kang et al., as well as Ota, Glenn Yu et al., and Chazari et al. Differently studied, compared. Coming to the conclusion part, univariate analysis, retinoschisis, hyperreflective foci have poor baseline vision, whereas cyst size less than 15 micron have better visual acuity at the time of presentation. Neurosensory detachment, ISOH junction break, drill, logMAR vision less than 1, central retinal thickness less than 500 have shown better response to injection ranibizumab. After multivariate analysis, younger patients response better to the treatment. Patients with cyst size less than 15 micron had better visual prognosis, and central retinal thickness is good visual prognosis. These are some actual photographs of the patients who have shown improvement after the injections.
The time is up. The time is up. Yeah. Any questions?
Is there any other systemic association? Like
most of the patients were hypertensive, but we haven't included the systemic distinction between the study population.
No, the question is, anybody is diabetic in this 100 cases? No diabetic, only hypertension.
Only hypertension, only patients with RVOs.
Okay.
Did you have to repeat any injections?
Yes, at the first, when patient arrived to us and diagnosed with the RVO, we took the OCT scanning. After giving first injection, we followed up the patient for the second, 1 month after the first injection. We assessed the data, and on that basis, we decided whether to give the second injection or not. Those patients who received second injection, after 1 month after that, we assessed those data also. And patients who received third injections, we did not include those data in this study. But patients who had shown improvement after 1 injection only, we have followed up that patient after 3 months and included that data as well.
Why that patients who didn't improve after 3 months were not included? Because that will have a bias on your results, right?
Yes, sir. But due to limitation of time period and also difficulty in following up the patients in the rural part of Maharashtra, it was difficult to really cope up with that.
Do
Ranibizumab, sir, Lucentis we had used 0.5 mg pre-filled in all the cases. No, 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 sir. It was, it was a thesis topic. It was a research topic, so it was funded by institution only. We do get research fundings from the institution throughout our thesis, so we do provide.
No, no, forget about that. Actually, that is not in the. It's not relevant to this. Yeah, it's not in this. Okay. Thank you very much. Thank you.